You're just throwing you around. Good morning. Thank you for being here today. My name is Kelly Plagg, and I'm the Executive Director of Susan G. Komen Sacramento Valley Affiliate. Komen Sacramento is thrilled to host this press launch right here at the state capitol today to announce an exciting, ambitious, and intensive statewide effort to address breast health disparities in African American women. When Susan G. Komen was founded 30 years ago, the survival rates for breast cancer patients was about the same with Caucasian women and African American women. And with early detection and prevention services and treatments, we have seen a decline in the death rate, about 34% over the last 30 years. But this is not the case for all women. When it comes to breast cancer, African American women have a different story. Today, when an African American woman is diagnosed with breast cancer, she is 41% more likely to die than any other racial or ethnic group in the United States and in California. This is unacceptable. And as an organization whose mission is to save lives, it is imperative that we take action. So today, the 7 affiliates of Susan G. Komen in California are launching the Circle of Promise California initiative to educate, to bring awareness, and to provide African American women breast cancer screening and navigation services to a medical home. But to be successful, Komen must have a partnership and support of the African American community. We need policy leaders, faith leaders, health leaders, and community leaders, as you see here today. And together, we have hope. We have hope that together, we can rewrite the story for African American women and breast cancer. I am proud to introduce our speakers today and supporters of this initiative. First, I am proud to introduce Senator Holly Mitchell. Senator Holly Mitchell proudly represents the 26th District of the State Senate covering South Los Angeles. She is the chair of the California's Legislative Black Caucus and serves on the Select Committee of Women and Inequality. Mitchell previously represented the 54th District in the Assembly, where she chaired the Assembly's Budget Subcommittee on Health and Human Services and the Select Committee on Foster Youth, and was a member of the committees on Health, Insurance, and Public Safety. I am very proud to introduce you to Senator Holly Mitchell.
Good morning and thank you. I'm proud to stand here with my colleagues in the legislature, Chairwoman of the Women's Legislative Caucus, Assemblywoman Bonnie Lowenthal, and members of the California Legislative Black Caucus, Dr. Shirley Weber, representing San Diego, Assemblymember Steve Bradford, representing South LA, Assemblymember Reggie Jones Sawyer, representing Central Los Angeles. I'm also proud to stand here as a long-term Komen LA supporter, former board member of Breast Cancer Action, Breast Cancer Early Detection Program Advisory Committee member, and just a long-term women's health advocate who's worked collectively with African American women representing survivors and warrior organizations to bring this issue to the forefront. As you heard earlier, a troubling racial divide in breast cancer mortality rates continues to widen in most major cities across the United States, suggesting that advances in diagnosis and treatment are bypassing African American women. An analysis of breast cancer mortality trends in 41 of the largest cities in the country showed that the chance of surviving breast cancer correlates directly with the color of a woman's skin. Black women with breast cancer, whether they hail from Phoenix or Denver, Boston or Wichita, are on average about 40% more likely to die of the disease than our white female counterparts. In some cities, the risk is even greater. My hometown of Los Angeles, a black woman with breast cancer is about 70% more likely to die from the disease than our white female counterparts, according to research recently published in Cancer Epidemiology. As a black woman, this issue is not only very personal, but again, is startling and dismal, which causes all of us to ask the question, why? Why is there such a glaring difference in what's causing the gap to widen? Research shows that even though black women face a higher risk of breast cancer because of genetic differences and are at greater risk of some types of breast cancers, this fact alone does not explain the widening mortality gap developing in a relatively short period of time. Categorically stated, this difference can be better explained by lower access to screening, lower quality screening, less access to treatment, and lower quality treatment among black women. Black women generally have some of the worst health outcomes on almost all health indicators, and any campaign that will bring attention and access to our community is a priority for the California Legislative Black Caucus. Therefore, we, the caucus, stand in solidarity with Susan B. Komen for creating the statewide initiative focusing on black women's health, because we know that these free screenings will be the doorway to health care for many black women to not just receive their mammograms, but to have access to doctors and, most importantly, follow-up treatment. Clearly, it's time to roll up our sleeves and work together to find a solution to this disturbing trend and ensure that the next set of data shows a more equal drop in mortality rates than they do today. Thank you very much for your interest and participation in today's event.
Thank you, Senator Holly Mitchell. We really appreciate your support today. And now I'd like to introduce Assemblywoman Bonnie Lowenthal. Assemblywoman Lowenthal represents the 70th Assembly District in Long Beach. She is one of the most experienced and seasoned members of the legislature, having served in the City Council and the School Board in Long Beach. She is the chair of the Women's Legislative Caucus, and Bonnie Lowenthal brings her experience as a licensed mental health professional to work on Assembly Health Committee, where she has been a dependable advocate for patients and their caregivers. Please welcome Assemblywoman Bonnie Lowenthal.
Thank you so much for having me here today. Thank you, Kelly, and thank you, Senator Mitchell, for that very dismal report on the disparities that we are here to address. I represent the 70th Assembly District, which encompasses the greater Long Beach area. But as chair of the Legislative Women's Caucus, I'm here because I'm a proud partner with Komen for the Cure as we address disparities of women in the African American community. The Women's Caucus is bipartisan, bicameral, and representative of many minority communities. Thank you. We have a proud history of partnering with Komen affiliates in California and the work that you do on behalf of women and breast cancer survivors. Years ago, unfortunately, my sister was not one of those survivors, so this is a very personal issue for me. But as we're learning today, Komen is not just an organization that connects women and men to services. It's also behind the research that has led us to be here today for the very challenging data that is coming before us. So there is scientific data that our ethnicity has a very direct link to how we manifest this ugly cancer and how we survive. We know that access is everything, and that those of us who are here today are fighting for better access to health care all over the state, and in particular for those communities that are most impacted by this ugly disease. I'm very thankful to be a partner here today. I look forward to learning more and continuing our work together. Thank you.
Thank you, Assemblywoman Lowenthal. Now I'd like to introduce Reverend Tammy Denise. She is a friend of Komen, and she is an amazing woman. She is active in the church and community here in Sacramento and beyond. She's an ordained minister and has been serving the church most of her life. Reverend Tammy Denise is also a legislative ambassador for the American Cancer Society and serves on the Susan G. Komen Policy and Legislative Committee. She is also a breast cancer survivor, And after being diagnosed in 2004, she founded Carrie's Touch. Touch standing for teaching, outreach, understanding, caring, and healing. Carrie's Touch offers education and support to the African American community in the greater Sacramento area. I am pleased to introduce to you, supporter of this initiative, Reverend Tammy Denise.
Thank you very much. I stand before you this morning by the grace of God and by the skill of a very, very passionate medical team as a 9.5-year breast cancer survivor. What you see standing before you is not my story. What you see standing before you is the story of an 80-year-old woman who had a bilateral mastectomy and was afraid to look at herself because she didn't recognize her body. What you see standing before you is the 27-year-old single mother who had to stop her treatment because she could not afford to be off because of the side effects of chemotherapy. What you see standing before you today is the young man who's diagnosed with breast cancer, and he doesn't understand this pink thing. You see, my story is their story, and their story is my story. And the hope of Carrie's Touch is that we will change the image of the community around breast cancer as it relates to African American women. Most messages you hear are the mortality rates. Those are very true. That's why we founded Carrie's Touch. But we need to have more people that look like me, that look like my sisters and brothers behind me, that are standing saying, yes, we can survive this disease. That's why we've decided to support Susan Komen with this initiative. We are very, very hopeful about the potential that this initiative can bring to the community and to save lives of African American men and women. We will be calling on each and every one of you standing before me today in the future, asking you to take our hand and to walk as we change the face of breast cancer in the African American community from mortality to life. Thank you.
Thank you, Reverend Tammy Denise. Now I'd like to introduce to you Dr. Rena Pasek, who is a Komen scholar. Dr. Pasek is a professor of medicine at the University of California, San Francisco, and director of community education and outreach at the UCSF Helen Diller Family Comprehensive Cancer Center. She is trained in public health. Her expertise is in community health and health promotion across cultures. For more than 25 years, Dr. Pasek has pursued her passion to reduce cancer disparities in the diverse and underserved communities of the San Francisco Bay Area, and through research, education, and advocacy. Dr. Pasek's research has generated new understandings of the role of culture in efforts to reduce these disparities in breast and prostate cancers. Merging the research and community work, she established a faith communities partnership that fosters new health ministries in the African American community churches and brings best practices programs and training designed to build their capacity to promote health. Dr. Pasek was named one of the 60 Susan G. Komen National Scholars in 2010 in recognition of her leadership in breast cancer disparity research. Dr. Rena Pasek.
Thank you, Kelly. It's really an honor to be here and to be part of this exciting initiative. In the words of Martin Luther King, of all the inequities, injustice in health care is the most shocking and inhumane. The California affiliates of Susan G. Komen have come together to shine a light on the inequalities that are causing the excess mortality due to breast cancer among African American women. Over the past 20 years, public health researchers and programs have shown that we can eliminate the disparity in use of mammography. There's now parity between African American and white women in the use of mammograms. thanks to all those efforts. But as you've heard, the disparity in mortality persists. This is due to a long history of racism and discrimination that has led to double whammy. One part of that is that more black women live in poverty and are reliant on the safety net, the public health safety net for their health care. The other part is understandably a deep sense of mistrust on the part of African Americans when they approach that healthcare system. It's not sufficient to get a mammogram. When a woman gets a mammogram that shows abnormal results, she needs timely and high-quality diagnostics and treatment if she is diagnosed with breast cancer. There's extensive data showing what we call the quality chasm, the difference in quality of care received by low-income individuals compared to those who can go to the top medical centers. I'm very proud to stand with Susan G. Komen and the affiliates, this statewide initiative, who are going to shine a light on this inequity and we're going to work together to try not only to see what is going on, but to bring about changes. So I'm so delighted to see everyone here and to be part of this, and I thank Kelly Plague from Sacramento and all the affiliates and the leaders of California Komen. Thank you.
Thank you, Dr. Pasek. Finally, the support for this initiative comes in part from a grant from Anthem Blue Cross Foundation. And today we have a representative from Blue Cross Foundation, Dr. Sylvia Gates Carlisle. She is the California Managing Medical Director of Anthem Blue Cross of California. As a clinician, Dr. Gates had an active practice serving high-risk populations in central Los Angeles, and she is a national speaker on equality and healthcare disparities. She is responsible as the medical manager for Anthem Blue Cross. She is responsible for medical management and collaborates with 180 contracted medical groups. She is also a volunteer physician abroad at the Venice Family Clinic and was co-recipient of a Volunteer Physician of the Year Award. I'm pleased to introduce to you Dr. Sylvia Gates Carlisle.
Thank you for allowing me to join you today to discuss this very important issue. First, let me tell you why I am so passionate about this issue. Both of my godmothers had breast cancer. And unfortunately, many of us can talk about loved ones, colleagues, and friends fighting this disease. That's why on Mother's Day, instead of sending flowers and cards, I send every woman in my address book an email reminding them to get a mammogram. Mammograms are a foundational part of reducing healthcare disparities. We clearly know what to do. The evidence shows early screening and mammograms save lives. But despite that evidence, 1/3 of the women in California who should get a mammogram don't. 2 million missed opportunities. One of the reasons I'm proud to work at Anthem Blue Cross is our deep commitment to women and the fight against breast cancer. We have been long-term supporters of the Susan G. Komen Foundation because of their commitment to this issue, and the Anthem Blue Cross Foundation is proud to be a major funder of this initiative to reduce breast health care disparities and health disparities among African American women. In previous years, we've worked with the LA chapter to pilot this program, and we determined it's effective. And now we're ready to bring it statewide. We have committed to a grant of $390,000 over 2 years to empower African American women to all of Komen's 7 state affiliates. With the Anthem Blue Cross Foundation's funding, more than 2,000 women will be screened, and more importantly, they will enter a medical home where their care will be coordinated, excellent, and 60,000 women will receive local breast health information. Thank you very much.